Pneumonia is the infection of long parenchyma. What is long parenchyma? Long parenchyma includes alveoli, bronchi, bronchioles, blood vessels, basically all those structures that make up the mass of the lung. And the infection of this mass of the lung is pneumonia. See, pneumonia is a really easy topic if you know the basic concept from general pathology, because you are going to use your concept about infection, your body's ability to fight against this infection, and most importantly, the various steps that you learned under the topic of inflammation. That is why first I'm going to give you a small recap of the concepts of general pathology that you need to know so that you can understand pneumonia. Now again, whatever I'm going to show you right now is something that you must already know. But I know that as medical students, we don't remember much, do we? That's why a small recap of the general concept. See, whenever there is infection, this leads to injury. And when there is injury to vascular tissue, this leads to inflammation. And what happens during inflammation? What are the steps of inflammation? Very first, there is vasoconstriction. There is transient vasoconstriction, which is followed by vasodilation. Persistent, that is lasting for a longer period of time, persistent vasodilation. Now the blood vessel that is dilated, there is accumulation of blood. Due to accumulation of blood, there is increase in hydrostatic pressure. Due to increase in hydrostatic pressure, the fluid from inside the blood vessel gets pushed outside. And this fluid is referred to as transudate. Transudate contains little to no cell. When fluid from inside the blood vessel gets pushed outside, where will it go? It will go to various spaces that it finds, and it will lead to swelling. And swelling is referred to as edema. Here, since the edema is due to transudate, this is transudate edema. So first, what happens? Due to dilation of the blood vessel, there is increase in pressure within the hydrostatic pressure within the blood vessel. This leads to fluid being pushed out of the blood vessel. This fluid contains little to no cell, so it is referred to as transudate, and transudate leads to transudate edema or transudate swelling. Immediately following that, what happens? The permeability of the blood vessel increases. The permeability of the blood vessel increases. Now, it's not just fluid that comes out. Now, even cells comes out. RBCs come out. WBCs come out. Fibrin come out. The WBCs that come out first are neutrophils or polymorphonuclear cells. And when the inflammation takes place for a longer period of time, that is chronic, then comes out lymphocytes. Okay. Now this substance that comes out of the blood vessel due to increase in permeability of the blood vessel that contains fluid plus lots of cells is exudate. This is exudate. And the swelling due to exudate is exudate edema. Okay. This is the basic of the basic thing that you must already know from general pathology that you need to recap here right now. If nothing, at least remember, at least this much keep in your mind, that when there is inflammation, there is dilation of blood vessel, due to which transudate comes out. Transudate contains fluid, not cells. Later, due to increase in permeability along with fluid, cells come out. This is exudate. So transudate contains fluid with no to little cells. Exudate contains fluid along with lots of cells. The cells are red blood cells and white blood cells. The white blood cells that comes first during acute period of time is neutrophil, and the white blood cells that come later after chronic period of time is lymphocyte. Okay, now Finally, let's get into the itty-gritty stuff of pneumonia. What is pneumonia? Pneumonia is infection of lung parenchyma. What happens when there is infection? Dilation of blood vessel takes place. As a result, what leaks out of the blood vessel? First transudate, then exudate. Now see, within your lung, if exudate comes out of the blood vessel, where will it go? It will go to every empty space that it finds and goes and fills there. Now there are two types of empty space, interstitial space or intraalveolar space. See here, within your lung parenchyma, there is alveoli, and there is blood vessel as well. Now due to injury to blood vessel, it dilates. The hydrostatic pressure inside the blood vessel increases, and what comes outside is transudate. Later, the permeability also increases. So what comes out is exudate. Now this transudate, exudate, they have to go somewhere now. Where will they go? They will go and fill up the empty spaces inside the lung. There are two empty spaces. One is the interstitial space present in between the alveoli, and the other is the intraalveolar space present within the alveoli. So the fluid goes and fills up either the interstitial space or the intraalveolar space. Once it goes and fills up the space of the lung becomes form, kada, and this is referred to as consolidation of lung. See, very easy analogy. You have a balloon, and this balloon is filled with air. That's your lung right now without pneumonia. Now you take the same balloon and fill it with water. That's your lung in case of pneumonia. In case of pneumonia, the empty spaces inside the lung gets filled with water-like substance. And this filling of the empty spaces inside the lung is consolidation. Okay, so what is there? There is infection of lung parenchyma, which leads to inflammation. Due to inflammation, fluid leaks out and fills up the empty spaces of the lung. That's called consolidation. So this is the definition of pneumonia. Pathogenesis. Very easy. Why is pneumonia taking place? Due to infection. Whenever there is infection, your body tries to fight against it. If your body wins, hooray, you are healthy. If your body doesn't win, the infection wins and you have pneumonia. That's it. Pneumonia is caused by microorganism causing infection. Let's say this microorganism enters your body via any route, be it through inhalation, through blood, hematogenous, direct spread, whatever be the route. The microorganism enters inside your body. Once the microorganism enters inside your body tries to fight against it. It tries to fight against it. If your body wins, you don't get infection. But if the microorganism wins, you get infection. So the reason behind pneumonia is that your body does not win the fight. It does not win the war. So the pathogenesis is impairment in pulmonary antimicrobial defense mechanism. That is, your body defense mechanism is impaired. As a result, it is unable to fight against the microorganism leading to infection. Now, defense mechanism is of two types. There's systemic defense, and then there is local defense. Systemic defense means what? Once the microorganism enters the body, once the microorganism enters the body, first your whole body tries to fight against it, right? It's not just your lung, trachea, bronchi, bronchial, not just the respiratory system. It's your body also trying to fight against it. That is your systemic defense. That is basically your immunity trying to fight against it. So if your immunity is impaired or the systemic defense is impaired, obviously the infection wins. Local defense includes lung defense mechanism. Now this is more specific to your respiratory system. All the defense mechanism that your respiratory system follows to fight against infection, that's lung defense mechanism. And this is a huge topic of its own that you need to study under physiology. So under physiology, you study about lung defense mechanism, various ways the lung defends against microorganism, and then in each step impairment can lead to pneumonia. So a decrease in lung defense mechanism leading to decrease in local defense leading to infection and then pneumonia. Okay. Now the more important part of the lecture, and that is classification, the types of pneumonia. First, on the basis of clinical setting. So here's a huge table given in Robbins. Do as you please with it. Second, on the basis of causative agent or etiology. At the end of the day, pneumonia is infection caused by microorganism. Now, if this microorganism is bacteria, the pneumonia is bacterial. If it is virus, the pneumonia is viral. If it is parasite, the pneumonia is parasitic. And if it is fungi, then the pneumonia is fungal. Another, on the basis of anatomic reason, there are three types of pneumonia. They are interstitial pneumonia, lobar pneumonia, and lobular pneumonia. Okay, hear me out first. Hear me out. I said that whenever there is pneumonia, there is consolidation of the lung. Why? Why does consolidation of the lung takes place? It takes place because the empty spaces inside the lung gets filled up with exudate. Arey bhai, there is inflammation. So the content from inside the blood vessel leaks outside, right? Exudate comes outside, exudate goes and fills up the empty spaces. I said there are two empty spaces: intra-alveolar space, the space inside the alveoli, and interstitial space, the space in between the alveoli. If it is the interstitial space that gets filled up with exudate, the interstitial space that gets filled with exudate, then this pneumonia is atypical pneumonia. But if it is the intra-alveolar space that gets filled up with exudate, then this is typical pneumonia. In atypical pneumonia, since it is the interstitial space that gets consolidated by exudate, it is also referred to as interstitial pneumonia. So this is the first type of pneumonia on the basis of anatomic region. Under typical pneumonia, you have again two types. If it is a huge chunk of lobe or the complete lobe of a lung that is consolidated, then that is lobar pneumonia, the second type. But if there is patchy involvement, that is only certain patches of lung is involved, right? Certain patches of lung is involved. That is either the lobule of the lung or the bronchi and bronchiole of the lung. Then we call that lobular pneumonia or bronchopneumonia. Again, in more detail. So you have two types of pneumonia. If it is the interstitial space that is filled with exudate, atypical pneumonia. If it is the intra-alveolar space that is filled with exudate, typical pneumonia. So atypical pneumonia, exudate is in interstitial space. Typical pneumonia, exudate is in intra-alveolar space. Cough. When you cough, what happens? Whatever content is present within the respiratory tract, within the alveoli, gets pushed outside due to pressure difference. It gets pushed outside. In atypical pneumonia, since there is no exudate inside the alveoli or the alveoli is empty, the cough is dry, nothing comes out. But in typical pneumonia, the intra-alveolar space is filled with exudate. So when you cough, this gets pushed out of the mouth as well. So the cough is productive. Etiology. Typical pneumonia is due to bacteria. And there are three important bacteria that you need to know the name of. Remember the name of. Streptococcus pneumoniae, Klebsiella pneumoniae, Haemophilus influenzae. Atypical pneumonia, on the other hand, is usually due to virus. For example, measles. But there is an exception. One bacteria by the name of Mycoplasma also causes atypical pneumonia. Mycoplasma causes something called walking pneumonia. What is walking pneumonia? Walking pneumonia, it's a type of pneumonia caused by Mycoplasma where the symptoms are not that severe, so the patient can simply walk to the hospital. So walking pneumonia. Measles causes Hecht's pneumonia. What? Hecht's pneumonia. Hecht's pneumonia. Under typical pneumonia, again you have two types. If the consolidation of the complete lobe or a large part of the lobe of the lung takes place, that's lobar pneumonia. So if it's the lobe that gets consolidated, it's lobar pneumonia. If it's lobule that gets consolidated, or bronchi bronchioles that get consolidated, it's bronchopneumonia or lobular pneumonia. Under lobular pneumonia, you need to remember the 3 B's of lobular pneumonia. They are B for basal. As you can see, the involvement is of the base of the lung, so basal. B for bilateral. As you can see, both the lungs have been involved, so bilateral. And B for bimodal. That is, it is found in both extremes of the age, in young people as well, in old people as well. Okay. Now, LANNEC stages of lobar pneumonia. I don't know why lots of students find this difficult, because if you just know the steps of inflammation, this is done, brother. See, if you just know these steps, it's the same copy paste of these steps. LANNEC stages of lobar pneumonia. So it is divided into 4 stages. Number 1, congestion. Number 2, red hepatization. Number 3, gray hepatization. And number 4, resolution. Remember, the total time duration for all the stages is 10 days. Now, you need to remember for individual stage how long they last. Very easy to remember. Hear me out. Congestion starts in the first day, multiply by 2, 1 to 2 day. Red hepatization in 2 day, multiply by 2, 2 to 4 day. Gray hepatization in 4, multiply by 2, 4 to 8 days. Resolution in 8, it's a total of 10 days, so 8 to 10 days. Done. Congestion 1 to 2 day, red hepatization 2 to 4 day, gray hepatization 4 to 8 days, and resolution 8 to 10 days. Done. Okay. Now, each stage. First, congestion, which lasts from 1 to 2 days. I said during inflammation, what happens? During inflammation, what is happening? Hear me out. We are learning about the LANNEC stages of lobar pneumonia. Lobar pneumonia, that means a complete lobe of a lung or a huge part of the lobe of a lung is consolidated. So trace the lobe of the lung. Trace this lobe. 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 Okay, what is happening to the lobe? Second thing, lobar pneumonia is a typical pneumonia. That means the exudate is present inside the alveoli, in the intra-alveolar space. So trace this. Here is alveoli. Here is alveoli. Here is alveoli. Inside the alveoli, you are supposed to have air space. But now there is no air space. It is filled with something. What is that something? Hear me out. Okay. So the first step is congestion lasting from 1 to 2 days. There is infection. Due to infection, there is inflammation. Infection, then inflammation. In inflammation, the dilation of the blood vessel takes place. As a result, there is increase in hydrostatic pressure. As a result, the fluid from inside the blood vessel gets pushed out, and this fluid is nothing but transudate. And transudate contains little to no cell, and the edema due to transudate is transudate edema. So see here also, here is the blood vessel. There is engorgement of the blood vessel or the dilatation of blood vessel, due to which there is increase in hydrostatic pressure. So the fluid from inside, due to pressure difference, gets pushed outside. Where does this fluid go? This fluid goes and it accumulates in the air space within the alveoli. So the air space is now replaced with transudate. It is replaced with transudate. Transudate. So if I had to label it, I'll write two things. Number one, there is engorgement of blood vessel, and number two, the alveoli is filled with the airspace. The airspace is filled with transudate. Okay, so what will happen to the lung grossly? You have a balloon filled with air. You have the same balloon filled with water. Which is heavier? Obviously, the balloon filled with water is heavier. Here also, previously there was airspace, but now this airspace has been replaced by fluid, water-like substance. So the lung becomes heavy, weight, boggy. So you get boggy and heavy lung. Boggy and heavy lung. Second, red hepatization from 2 to 4 days. Okay, now after dilation, after hydrostatic pressure increase, there is increase in permeability. Due to increase in permeability, now not just the fluid comes out, now cells also come out. The cells include red blood cells, white blood cells, as well as fibers come out from within the blood vessel. You can see white blood cells, red blood cells. Which white blood cells come out first? Neutrophil or the polymorphonuclear cells. So you can see all the polymorphonuclear cells right here. Due to the leakage of red blood cells from inside the blood vessel, that red blood cell is filling the alveolar spaces now. So the lung appears red. The lung appears red. It is red. The air that was inside the alveoli is now completely replaced by cells. As a result, the lung becomes form like liver, so-called hepatization. That is, first the lung was like sponge, but now as the air spaces are filled with cells, it has become form like liver. The process is called hepatization, becoming like liver. So this step is called red hepatization. Red due to red blood cells, hepatization due to conversion of the spongy lung into form lung. Okay. Third, gray hepatization. All the RBCs that came into the alveolar space, they become old, they die, and they get eaten up. So all the RBCs are now eaten up. What remains? The WBCs, the polymorphonuclear cells, and the fibers remain. The WBCs and the polymorphonuclear cells or the fibers remain. And they give lung the gray color. Which color? Gray color. See, the airspace is still filled with cells. Previously, the cells were red blood cell, WBCs and fibers. Now it's just WBCs and fibers. RBCs are not there. So since the airspace is still filled with cell, the lobe of the lung is still formed, kada, like liver. So this is called hepatization. So the name gray hepatization. All right. Now, finally, all the cells that were present within the alveolar space get eaten up or digested by the enzymatic action. So the enzymes get produced, the cells get eaten up. Now all remains are the pieces of the cell, the debris, dhulo, the debris of the cell remain. And the cells that come later on, what are they? The lymphocytes. So the lymphocytes are there. Neutrophils come first, lymphocytes come later. So now you have lymphocytes and debris after all the cells have been digested. This is the phase of recovery, also referred to as resolution. So from 8 to 10 days, resolution takes place. That's the LANNEC stages. One last revision of LANNEC stages. First, you have congestion. In congestion, due to increase in hydrostatic pressure due to dilation of the blood vessel, transudate comes out, and the transudate goes and fills up the air spaces. So there is engorgement of the blood vessel and filling up of the air spaces by transudate. Since the lobe is now filled with water-like substance, it is heavy and boggy. Similarly, after that, there is increase in permeability of the blood vessel. As a result, along with fluid, cells also come out. These cells are red blood cells, white blood cells, and fibers. Due to red blood cells within the alveolar space, now the lobe of the lung is red in color. So red, and the lobe of the lung is firm in consistency because the air space is now filled with cells, solid stuff. So it is formed like liver, called hepatization. So together, red hepatization. After that, all the RBCs get eaten up. What remains are only WBCs, the polymorphonuclear cells or neutrophils, and fibers that give the gray color. Since the air space is still filled with cells, solid substance, so it is still formed like liver, so gray hepatization. Finally, all the cells, they get digested by the digestive enzyme and only the cell debris remain, and the cells that come later on in the chronic stage, the lymphocytes come. This is a phase of recovery, also referred to as resolution. And we are done with pneumonia as well.